Doctors usually tell you to cut back on sugar or take your meds properly to improve diabetes health. But they don't go into details about how much nutrients matter for diabetics. Without the right vitamins, insulin won't work as well. Nerves get weaker, and complications can creep up faster. And here's the crazy part. Most diabetics are low on these key nutrients without even realizing it. Ever feel tired all the time? Deal with aches? Or struggle to get your blood sugar under control no matter what you do? Chances are, your body is missing something important. Fixing that gap could make a huge difference in how you feel and how well you manage diabetes. Let's get into which ones matter most, and how to make sure you're getting enough every day. A small favor, if this helps. Please subscribe to support our work. Now let's start with the first one. Number 1. Vitamin B6. Most people don't think much about vitamin B6. But if you have diabetes, it's more important than you might realize. Your body loses B6 faster when blood sugar is high, because your kidneys flush it out, along with excess glucose. On top of that, inflammation and oxidative stress, both common with diabetes, push your body to use up more B6 for repairs. High insulin levels can also interfere with B6 metabolism, making it harder for your cells to use it properly. To make things worse, certain medications like metformin and blood pressure drugs deplete B6 even more, which is why many diabetics end up low on it without knowing. The tricky part is that a B6 deficiency doesn't always come with obvious symptoms. If you're feeling extra tired, struggling with brain fog, or dealing with mood swings, low B6 could be a factor. One of the biggest warning signs is nerve issues, tingling, burning, or numbness in your hands and feet. Muscle weakness or poor coordination can also show up, since B6 is key for nerve and muscle function. Dry, flaky, or irritated skin, frequent mouth sores, and a weaker immune system are other signs to watch for. In severe cases, low B6 can even lead to anemia, causing dizziness, pale skin, and shortness of breath. A B6 deficiency can affect multiple systems in the body. It plays a big role in fertility. Low levels can reduce testosterone and sperm quality in men, while in women, it can lead to irregular cycles and worse PMS symptoms. It also affects libido, since B6 helps regulate dopamine and serotonin, which control mood and energy. The nervous system relies on B6 for nerve repair and protection. So without it, nerve damage can worsen, increasing pain and slowing recovery. The kidneys need B6 to fight inflammation, and when levels drop, the risk of kidney complications goes up. Eye health can take a hit too. B6 helps protect the tiny blood vessels in the retina, and without enough, diabetic retinopathy can progress faster, leading to vision problems. The heart and blood vessels are also at risk. B6 helps lower homocysteine, an amino acid that can damage arteries and increase the chances of high blood pressure, heart attacks, and strokes. When B6 is low, blood vessels get stiffer, making circulation problems worse. On a cellular level, B6 is essential for glucose metabolism. It helps break down glycogen, the stored form of glucose, so energy is released steadily instead of spiking and crashing. Without enough B6, blood sugar becomes harder to manage, and insulin resistance can get worse. It's also critical for neurotransmitter production, which explains why low levels can lead to anxiety, mood swings, and depression. B6 is needed for hemoglobin production, which carries oxygen in the blood. Without it, cells don't get enough oxygen, leading to fatigue and slower healing. The best way to get enough B6 is through food. Chickpeas are one of the richest sources, with just 1 cup cooked, covering about 55% of your daily needs. Beef liver is another powerhouse, giving around 50% per 100-gram serving. Wild-caught salmon provides about 40% per 100 grams, making it a great protein choice. Turkey delivers around 40% of daily B6 per 100 grams. And sunflower seeds offer about 30% per ounce. These foods don't just help maintain B6 levels, they also support nerve health, immunity, and metabolism, making them especially beneficial for diabetics. If you enjoy gourmet meals, some high-end dishes are packed with B6. A Japanese-style miso-glazed salmon with chickpea puree sunt 80 gram. Salmon, 1/2 cup chickpeas delivers over 90% of your daily needs, while also supplying omega-3 seconds for heart health. A French beef liver pâté with roasted garlic potatoes, 100 grams liver. One medium potato provides around 85% of daily B6, along with iron and B12 for better energy and red blood cell production. A Mediterranean chickpea and grilled lamb stew with saffron, 200 grams lamb. 1 cup chickpeas delivers about 80% of daily B6, while also offering essential amino acids for muscle repair and immune support. If food isn't enough, supplements can help. The best forms of B6 come in bioavailable versions like P5, P-pyridoxal, 5-phosphate, which your body can use immediately. Thorne Research P5P 33 mg per capsule is one of the top options since it absorbs well and supports nerve function. Another great choice is Pure Encapsulations Vitamin B, 650 mg per capsule, which provides a solid daily dose. Most diabetics do well with 25-50 mg per day. But if you're considering higher doses, it's best to check with your doctor. Some foods and habits can actually make a B6 deficiency worse. Refined grains like white bread and pasta lose most of their B6 during processing, so it's best to avoid them. Diets high in sugar burn through B6 faster, since insulin spikes increase the body's demand for it. Alcohol is another problem. It interferes with absorption and increases the breakdown of B6 in the liver. Certain medications, including birth control pills, metformin, and blood pressure drugs, can also drain B6 over time, which means replenishing it through food or supplements is essential. Vitamin B6 might not get much attention, but for diabetics, it's a game changer. It helps insulin work better, protects nerves, supports heart health, and keeps energy levels stable, making it one of the most important nutrients for overall diabetes management. Number 2. Vitamin E. Think of vitamin E as your body's natural shield, protecting your cells, nerves, and blood vessels. But here's the problem. Diabetics burn through it faster than normal. High blood sugar causes more oxidative stress, meaning your body has to use up more vitamin E to fight off damage. And since vitamin E is fat-soluble, it needs healthy fats to be absorbed properly. If you have diabetes, fat metabolism isn't always efficient, making it harder to maintain good levels. The tricky thing about low vitamin E is that it doesn't always have obvious symptoms. The first signs might be muscle weakness or trouble with coordination. Vitamin E is crucial for nerve function. So, when levels drop, signals between your nerves and muscles don't work as well. Numbness, tingling, or burning sensations in your hands and feet can get worse, making neuropathy more painful. If your skin feels dry, irritated, or slow to heal, low vitamin E might be the culprit. Vision problems like trouble seeing at night or increased eye strain can also be a red flag, since vitamin E helps protect the tiny blood vessels in your retina. And if you find yourself getting sick more often, that could be another sign. It plays a key role in supporting your immune system. A deficiency in vitamin E can affect nearly every system in your body. It impacts fertility since it's essential for healthy sperm and egg production. In men, low levels can reduce sperm quality. In women, it can disrupt hormone balance. Libido can also take a hit because vitamin E improves blood circulation, which is critical for sexual function. The nervous system suffers too without enough vitamin E. Nerve cells become more vulnerable to damage, making neuropathy worse. Your kidneys also struggle, since oxidative stress is a major cause of kidney damage in diabetics. Eye health suffers because vitamin E protects the blood vessels in the retina. When it comes to heart health, vitamin E helps keep arteries flexible, reduces inflammation, and prevents cholesterol from oxidizing, lowering the risk of heart disease. At a cellular level, vitamin E acts like armor, protecting your cells from oxidative stress. It helps stabilize cell membranes and preserves essential fats inside your cells, keeping your nerves, muscles, and blood vessels strong. It also improves insulin sensitivity by reducing inflammation and helping glucose move into cells more effectively. Another major benefit, it regenerates other antioxidants, like vitamin C, strengthening your body's defense system. Luckily, there are plenty of natural ways to boost your vitamin E levels. Sunflower seeds are one of the best sources. Just 1 ounce gives you about 66% of your daily needs. Almonds pack around 48%. Hazelnuts about 28%. And cooked spinach delivers 20%. Avocados are another great source, giving you around 15% per medium-sized fruit, plus the healthy fats needed for absorption. If you enjoy gourmet meals, a Mediterranean-style grilled sea base with an almond herb crust, 180-gram fish, 1/4 cup almonds delivers over 70% of your daily needs. A Japanese roasted duck breast with a hazelnut miso glaze, 200-gram duck, 1/4 cup hazelnuts gives around 65%. A French avocado and sunflower seed tartar with truffle oil, 150-gram avocado, 2 tablespoons sunflower seeds supplies about 60%. If food isn't enough, supplements can help. The best choice is natural vitamin E D-alpha tocopherol, which is better absorbed than synthetic versions. Pure encapsulations vitamin E, 400 IU per soft gel, is a top option, offering a potent and bioavailable form. Another solid choice is Now Foods Vitamin E, 400 IU, which includes a balanced mix of tocopherols. Most diabetics do well with 200-400 IU per day. But don't go overboard. Excessive vitamin E can thin the blood. Some habits can make vitamin E deficiency worse. Processed vegetable oils like soybean and corn oil increase oxidative stress and deplete vitamin E. Diets high in refined carbs and sugars cause inflammation, making your body burn through more vitamin E. Alcohol damages the liver, which reduces your ability to store and use vitamin E. Low-fat diets can also be a problem, since vitamin E needs fat for absorption. Even overcooking vegetables destroys much of their vitamin E. So lightly steaming or eating them raw is best. Vitamin E plays a massive role in protecting against diabetes complications. But most people have no idea they're running low. It helps insulin work better, protects nerves, keeps blood vessels flexible, and reduces inflammation. If your blood sugar has been harder to manage, nerve pain has gotten worse, or your skin feels drier than usual, you might need more vitamin E. Getting enough through food or supplements can improve circulation, boost immunity, and keep your body more resilient. If this helped, please subscribe to support our work. Now, let's move on to number 3. Number 3. Vitamin C. Vitamin C isn't something most people think about until they're running low, but for diabetics, that happens more often than you'd expect. High blood sugar burns through vitamin C faster because glucose and vitamin C use the same pathway to get into cells. When there's too much sugar, vitamin C doesn't get absorbed properly. On top of that, diabetics deal with more oxidative stress, so the body needs extra vitamin C to fight off damage. And since it's water-soluble, frequent urination flushes it out, making deficiency worse. Low vitamin C doesn't always show obvious signs at first. If you're feeling exhausted, bruising easily, or noticing that cuts take forever to heal, that's a sign your body isn't making enough collagen, which vitamin C is crucial for. Bleeding gums, dry skin, and frequent illness are also indicators. Joint pain and stiffness might get worse since vitamin C helps protect cartilage. In severe cases, a deficiency can lead to anemia. Being low on vitamin C doesn't just make you feel sluggish, it impacts major systems. It affects fertility, libido, the nervous system, kidneys, eyes, and especially the heart and blood vessels. Vitamin C keeps arteries flexible, reduces inflammation, and helps prevent plaque buildup. Without it, blood vessels stiffen, blood pressure rises, and heart disease risk increases. At the cellular level, vitamin C acts as a powerful antioxidant. It lowers oxidative stress, supports collagen production, boosts the immune system, and regenerates other antioxidants like vitamin E. Without enough, cells become inflamed and function poorly, speeding up diabetes, complications. The good news: it's easy to get enough through food. Kakadu plums are the best source. 100 gram provides over 3.0% of your daily requirement. Acerolacari's give about 1.5. Red bell peppers about 200%. Kiwis 150%. And strawberries 90%. For gourmet options, a tropical ceviche with kakadu plums, citrus marinated salmon, and red bell peppers delivers over 2.0% of daily needs. A Japanese yuzu-infused tuna tartare with kiwi salsa offers 1.5. A French acerola cherry sorbet with dark chocolate shavings provides 800%. If food isn't enough, supplements can help. Liposomal vitamin C is one of the best options because it's absorbed efficiently. Live on Labs. Liposomal vitamin C, 1,000 milligrams per packet. And pure encapsulations, ascorbic acid, 1,000 milligram capsules are both great. Most diabetics do well with 500 1,000 milligram per day. But higher doses might help during illness. Some habits make vitamin C deficiency worse. Too much sugar, alcohol, smoking, processed foods, and overcooked vegetables all reduce absorption. Vitamin C is one of the easiest ways to strengthen your immune system, improve insulin function, and protect your heart. It helps prevent neuropathy, kidney disease, and vision loss. Whether through food or supplements, getting enough vitamin C can make a real difference in managing diabetes and staying healthy. If you've been dealing with frequent infections, slow healing, or constant fatigue, low vitamin C could be part of the problem.